Hi YouTube, how you guys doing? My name is Ellie and I am a transgender person. So in the past I would open these videos saying, I'm a non-binary person for lack of a better word. Which I guess now the word transgender just fits a little bit better, so I'm going to be using this from now on. But if you have any strong feelings one way or another, you can use the other term. Okay, so welcome to my channel. If this is your first time watching me, allow me to introduce myself very quickly. So I am 34 years old. I have been on testosterone HRT for 3 years. I started at a minuscule dose. And I'm taking it as a masculinizing hormone because I was born female. And I was okay with this for a while, and then turned out wasn't so okay with it, so I changed it and started taking male hormones. I make it sound like I didn't put a lot of thought into it, but I put a couple of good years of thought into it, so hold up with the comments. Okay, so this is my 3 years and 2 months mark. I think, maybe 3 months. I haven't really seen many changes from now, looking back on a month or two, but 4 or 5 months, you can already note some pretty impressive changes. For example, my beard really came in, and go and take a look. It's kind of, I mean, it's not full yet, but it's definitely defined, and I shaved this part up here because I don't like the hair coming up that high. But it is connected to my, what do you call these? Sideburns. And then I have a pretty impressive neck beard. And it's connected on one side of the mouth, though on the other one is not. I don't like to shave it as much because I get a serious baby face. Like I basically, when I shave, I don't pass as well. When I have the beard the way it is now, I pass 100% of the time stealth mode unless I actually actively tell people that I'm transgendered. So what would happen is I could casually mention it and people will not pick up because you know how cis people are. So I would have to, I could actually say something about my period or the hormones and people would just have no fucking idea, and I would have to grab them and explain to them that I was born female. I took hormones. This is why I look like a dude, you know? And then they sometimes register it, but other times not so much. Like they think I'm trans in the sense that I was born male and I want to become female, and then they're really confused, which is just hilarious. Yeah, so pretty much, unless I actually chose actively not to be, to come out. It's interesting, people do treat you completely differently when you are a queer looking person and when you are just a cis, normal looking person. It's very different. Like people are a lot nicer, a lot more open, a lot more friendly, and a lot more inclusive when you don't actively look queer. Now, I have been looking queer for most of my adult life. So that's a bit too much for me. I feel alienated from my community, the gay community, the lesbian community, the trans community, even when I am that stealth passing. So I actively take some steps to look a little queer, you know? So I get the colored hair and I might wear something that's a little gayish looking, and I will take my shirt off in places just to make sure that everybody knows that I'm trans. If I'm training there, for example, I like to take my shirt off in the training gym because I want to be visible as a transgender person. I want to be visible as a queer person as long as it is safe for me to do so. So when I can, I definitely try to speak about it and try to take my shirt off and try to have people informed that I'm queer, but sometimes that's not an option. Sometimes it's just walking in the street and you're just being read. And I usually am being read as a gay, feminine, 25-year-old guy, which is hilarious because it's quite far away from what I actually am. But the guy part is nice. The guy part is key, and the rest of it, I'll just take it for the ride because it doesn't really matter what other people put on me as long as I'm comfortable with how they gender me, if you know what I mean. Because people can put stuff on me for my nationality, for my skin color. I was called a white girl by some guy online, and I was just laughing because, first of all, the definition of white as it is used by American people just doesn't apply in Israeli society, and I didn't grow up with that, so it's kind of empty of meaning for me in that sense. And they call me a white girl because I never bothered to change the channel photo on YouTube, so it literally just shows my face back when I was a woman. And I was like, white girl, oh my god, like with this beard? Right, okay. With these here guns? Okay, good. I'd love to be that kind of white girl. Anyways, yeah, so passing completely, 100%. And I have to say that I am comfortable with passing. I'm not comfortable with being read as cis straight in the sense that it marks me as not queer, but I am 100% comfortable with being read as male, which is a surprise. I didn't think that was going to go down that way. I thought I was going to be bothered by that a lot. But a lot of the social roles and privileges assigned to male are actually quite comfortable and cozy, so I'd be lying if I say I didn't like it. I wish it didn't have to be like that. I wish roles were more flexible and that women were afforded the same privileges the men are, but I can't lie and say that I don't like the way things are going. I do my best to kind of extend whatever I'm getting to cisgender women and queer people because, you try to create the world you want to live in. But there's some things that you just cannot replicate. For example, the way straight girls now look at me is different because I didn't used to look attractive to them. And obviously now I do. So like the girl at the supermarket that does the cash register, just women in general look at me more and smile at me a lot more, which I assumed that before the women who would look and smile at me were more gay or queer or somehow butch oriented, and they saw something in me that either they were attracted to or they were interested in or they identified with. But now I just get it from women in general. Like women are a lot more interested in me. And men are a lot less interested in me. It's like they don't notice me very much. And which is a good thing. I love that. And then sometimes I get like the bro attention, which is like kind of taking for granted that I understand whatever it is that they're feeling. And there is a lot of fraternity and there is a lot of eye-to-eye level kind of very direct, very easy communication with men right now. So that's a definite plus. I like being included in the guy group. I didn't think I would like that, but I actually really, really like it. I actually really enjoy being treated as one of the guys, which is the main reason why sometimes I choose not to out myself as transgender. And you know what? Fuck anybody that has an opinion on that, because it's me and my life. And if I choose not to out myself and I choose to be treated as cisgender because I like that, that's me. And I do a lot of queer activism when I can, and sometimes I don't. And I'm good with that. I enjoy that right now. Okay, so I don't get gay vibes from guys. Maybe it's because I'm not really that attracted to guys, so maybe if they are interested and they show it, I'm just not interested enough to pick it up. But I am still kind of interested in guys in a way, at least sexually, so maybe at some point I will consider that. As far as dating goes, I haven't done any of that. I just absolutely haven't dated anyone since separating from my ex, who is also still my wife, and I'm going through a divorce, so I don't really feel obligated to jump back on my feet so quickly in the sense of having relationships or dating. But getting divorced from a 5-year relationship for me also coincides with finally passing as a man, which really changes the game. So I've been trying to at least flirt with people to kind of try out the wheels on my new car, if you know what I mean. But I can't say that I've had any kind of romantic, meaningful interaction with anybody in the last 8 months. So, what other changes have I lived through? Okay, so the sweat thing I always talk about. I do sweat a lot. I think more than what other people sweat, but I also work out more than most other people. I'm in Spain, Barcelona, so the climate is kind of warm, not as hot as it is in Israel, but there are no air conditioners. Wow, shit. What do you call them? No air conditioning anywhere, anyways. And that includes training spaces. So you just sweat profusely. Maybe I sweat more than I did on estrogen. Maybe the humidity here is higher than it was in Tel Aviv. I don't know. Doesn't bother me and I don't care. The beard is a huge plus. I haven't lost my hair yet. I think it has receded a little bit around here, the temples, but I haven't noticed any important thinning. So I'm just trying to have fun with it as much as I can before I eventually and just unavoidably lose all of it, just like all the other men in my family from both my mother's and my father's side. So just let me enjoy this. Just give me the blue hair for another 2 years and just so I can have the pictures, okay? When I go completely egg bald, I just want to have the pictures. Okay, so there's that, and I've gained a lot of muscle, I think, right? I mean, it looks good. I look big. Yeah, I'm not even wearing a binder because I don't need to wear a binder to pass. Yeah, that's what I look like now. I always do this pose. I think I filled out a little bit. And then I always do this pose. And I like to know what I look like, toe to head, just the whole, this is what it looks like. I mean, I think it's important to know that you can completely pass without hiding your breasts. So for me, the binder really gives me a lot of back pain and a lot of rib pain, and I'm not stoked on it. So I only wear it when I feel like if I don't wear it, it would be making a statement that I don't want to make. So when I'm with patients, treating them, the thing is, when you're a therapist, the important part is not to make it about yourself. It's about the patient. And if you have the intuition that the interaction would go more smoothly if you binded, or if you used a certain pronoun, or if you mentioned or didn't mention something about yourself, and just do it, because the point of it is not to focus on you, it's to focus on your patient and give your patient the best environment to conduct their therapy in a most conductive way. I mean, of course, don't do anything that makes you uncomfortable, because that's not part of the job description either. You don't have to make yourself uncomfortable for other people to have their treatment. But I just try to make a point of not making myself the point of the treatment. Like, I would never mention to a patient that I was transgender doing a therapy session unless they distinctly asked me about it. As in, I wouldn't hide it, but there is no need for me to speak about it, because that's not the point of this here session. Like, the point of this here session is like your twisted ankle or your neurological dysfunction or whatever, or your personal training, whatever it is, not me being or not being transgendered. So somebody asked me about being a physical therapist and how is that affected, or how does that affect, or how does that interact with being transgender? And I have to say that it just really doesn't. It's a profession. And besides the part where women are always being treated a little unequally in the workspace and in the work world, like the marketplace, which has stopped ever since I started passing, which sucks. But, we got to be in the world to change it. So just try to make the world better for everybody, women, minorities, everybody. So that's changed a little bit, but I don't think it's very different across professions. And then there aren't any special things that I can or cannot do now that I'm a guy as a physical therapist. Like, if my patient had to take off their shirt, I would turn around if they had breasts, like if they were taking the shirt off in order to put a towel on or something like this, I would turn around being female or being male. It's about privacy, it's not about gender. And if I had to look at my patient, I wouldn't turn around if I were male or if I were female. So it really just depends on the context, and it really just usually doesn't come into play. I mean, the only reason it would affect me, I think, is when I have to deal with people whose worldview is not congruent with transgender identities being a thing. So either highly religious people or very right-wing people, very, very old people who just haven't had the experience to kind of go along with that, to make sense of that. And what I do in these cases is I just keep my opinion to myself, because your patient can say things that in another situation would be kind of, but when they are your patient, they are also your responsibility and they are under your care. And it's not about your feelings, it's about the patient. So unless it's actually aggressive, unless they actually insult you, unless they actually attack you physically or verbally or whatever, don't make it your crusade, okay? This is not the moment. So whenever I treat someone whose opinions differ very widely from mine, I just try to steer clear of any discussion about these opinions, because I'm not there to change their minds. They're not going to change my minds. And any kind of friction caused by this kind of discussion will only interrupt therapy. So I try to just steer clear of that. Of course, if they insist, then we can speak about it, as long as everybody's being civil and respecting everybody's privacy, which doesn't really happen. Like, people usually don't, in the middle of a therapy, ask me personal questions. It just doesn't happen. It happens the other way around when you're a patient, but it doesn't often happen that patients direct very personal questions towards their therapist. It's just not the dynamic. It's a power thing. So that doesn't happen to me. If they do mention something, it's usually respectful, because people are respectful towards figures of authority. And when you are a patient, your therapist normally is a figure of authority. So I don't really get shit for being transgender, even from patients who might not be as respectful in other circumstances. Apart from that, there's the looking for a job part, like the job hunt, which I need to do soon, because even though I work autonomously, I need to get a place. I mean, I need to get hired somewhere soon. So that's going to be different, because I'm going to have to either change the resume to say male and just go stealth, or actually address the issue. But I am being helped by a service called Transocupación, which is a service from the Barcelona City Hall, which helps transgender people find their place in the work market. So get a job, start their own thing or whatever. So one of the questions they ask you is, when we introduce you to future employers, how do you want us to speak of you? And I said, just please be 100% open. I would prefer to not be hired by a person who's a little bit transphobic than to be hired and have to deal with that in my boss. So maybe that's something. I don't know, I'll let you guys go. I'll let you guys know as I go job hunting if there's anything that happens there that's interesting. Okay, so we've posed around, we've spoken about jobs and about my beard, and about my voice. Yeah, my voice has been steadily dropping, I think. Or maybe I'm still learning how to use the lower range of it. I still use a higher register a lot of the time, but it kind of hurts my throat, so I try to do it less, and I like the sound of the lower register, so that's another reason to practice it. But it is hard to change your speaking patterns. I did want to speak on why it took me so long to transition and why I had transitioned so slowly, even though I'd started transitioning already. So for me, it had a lot to do with feminism and the way I picked up feminism, which was mainly from lesbian women. So there is this paradox where lesbian feminism is very anti masculinity, and masculine at the same time. So of course, that is both too general and too specific at the same time, but bear with me. This is what I went through, not what you went through, not what anybody else went through. So just listen to me and stop judging and stop with the freaking comments. Okay, so the feminism that I picked up, because it was shown to me, because I was susceptible to it, because blah, 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 was quite anti-men at the time. And I started thinking of myself as a lesbian quite early, maybe as 14 or 13, and I read a lot of lesbian literature, and I found myself there. It echoed very, very much. And a lot of the gender deviance that goes on within the cis woman sphere is quite revolutionary in the sense that it feels like you're fighting against something. So a lot of AFAB people, when they dress masculine or when they portray masculine behaviors, they meet with a lot of antagonism, and a lot of that antagonism comes from men, from cisgender men. And if you're not even attracted to men, but you like presenting masculine, and then you get shit from men for presenting masculine, and shit from cis women for presenting masculine, usually the shit you get from men, you would retort more harshly towards. Because women are likely to come at you from feminism, while men are likely to come at you from a non-feminist place. So you're already predisposed to explain yourself to women, but you really don't like having to report to men. And you've never had an emotional connection or a pair bond with a guy, so you don't really have a lot of insight into their emotional world. So you kind of take them at face value, which is a silly thing to do with men because they have a really hard time expressing what they feel. So if you take them at face value, that's usually pretty far away from their actual message. Which is the kind of silly thing that men like to say. Oh, we just go straight to the point. We just say what we mean. Y'all beat around the bush so hard, the bush is like running away screaming. Like, you say everything except what you actually mean, and you use really convoluted ways of showing it, and then you're surprised that nobody gets you. Like, women just say what they mean, and it's pretty easy to understand women. It's men who are complicated and mysterious, not the other way around. That's silly. So I grew up not really understanding how guys work, in the sense of how interaction between guys work in groups of guys or with guy friends. And I was really mostly normally with women. Gay women more than straight women, but women. And yeah, that's something that really changes the way you perceive and have interactions. So I had this really anti-boys thing, which like boys are chauvinists, boys are misogynists, boys are everything wrong with the world. And I was also fairly jealous of them. I used to be fairly jealous of the way their bodies looked and what they were capable of. Not the dick part, can we get off the dick part? It's just, the dick is the least important part of it. You know, just get a dildo. Just buy yourself a dildo. Okay, so I really wanted to be a guy, but because of all this construction that I had internally of feminism being something that is conflicting with being a guy, because men can be feminists, right? I had a really hard time admitting that I wanted to be a guy, which is a pretty simple conflict now that I actually put it down to words. But it took a surprising amount of time to resolve. And it wasn't until my biological father passed away, which he wasn't very much of a parental figure in my life. He was more of a menacing presence. Um, I wasn't abused as a child. Please take that thought off of your head. But I did not have a good relationship with my father. I hardly had a relationship with my father, but what I had was kind of menacing. It wasn't until he was actually dead that I felt free enough to try and explore this part of myself. Because the one thing in my life that's pretty clear to me is that I want to be like him, and I am not like him in any way. But I knew that if I would go male, that I would look a lot like him physically. Because I already, as a girl, looked very similar to him. I had the same bone structure and the eye color and the stature and the tendency towards body weight and all the rest of it. But thankfully, I'm very athletic, and it's not the physique that he had. He was a big fat guy, big fat bald guy with a huge beard. So I do look quite different from him. Plus, I'm not as big. I'm just 175 centimeters, and he was a lot taller than that. Yeah, so as soon as he passed away, I felt a lot more comfortable exploring that, but it still took me like 3 or 4 years to actually get on testosterone and start experiencing myself on this hormone and letting myself enjoy the changes. And every time that I enjoyed the changes, I would feel like, oh, but I'm losing my femininity, and then it would kind of turn into this, I am non-binary and I want to stay non-binary because I don't feel comfortable saying that I want to be a guy because I hate guys. And when I started hating guys less is when I started accepting myself as a guy, which really took me on a different path than I thought I would be. I thought I would be chilling in the middle for my life, and then I realized that I can actually have meaningful relationship with guys, friends or lovers or whatever, but they're not all assholes, which doesn't sound surprising, but it did surprise me because I had a very, very tightly held construction that said that they were assholes. And I did that while being married to a woman and while being defined as a lesbian. So I think I deserve some applause on being able to change my mind. And I invite you to consider if you have any animosity towards men that might be holding you back in your transition. In the sense that you can have whatever opinion you want about men. That's not my business and I don't care. The thing is, do your opinions about men as an AFAB person who wants to masculinize themselves, are these opinions helping you, or are they a burden to you, or are they completely irrelevant to what you're doing? All I'm saying is, put some thought into it, because that's important. That was key for me. And it took the time it took, and the experiences it took, but I'm very happy to say that I don't feel that way anymore, and I'm capable of having meaningful relationship with guys, and I'm capable of seeing myself as a guy, which makes me feel just better. Yeah. And the last thing I want to talk about is top surgery, which during quarantine, the possibility came up that I would have top surgery in Israel, which would require me to go back to Israel. I gave that up. I didn't do it. I wanted to do it, but I was scared of it, and I didn't do it. And I wanted to do it for all the right reasons. I feel like my chest is under my breasts in a certain way. I know that I would love it. Every time I look in the mirror, I do this or this. Like, all these little things to try and hide your chest so you can kind of imagine the contour of your body without breasts. I've been doing that for years. I can't remember a time when I didn't do it, And, well, maybe when I was very young and I just got breasts and they were kind of not perky from the get-go. You know what I mean? When I was like quite a young adolescent, my breasts kind of like went droopy very fast, and I thought that was not fair. So I would kind of try to pull them upward a little bit to make them more perky. But I started pretending that I didn't have them or tried to hide them in my early 20s. After one girlfriend that I had, who confessed to me that she didn't like her breasts and she would really prefer to not have them and that she had considered removing them. And I was like, oh my God, you can do that? Wow. And ever since then, I had toyed and played with hiding my breasts, and it just became more and more and more until it finally became clear to me that I just don't want them there, you know? So that's the good reason to have top surgery. And then there's the reason, which I'm not so sure is a good reason, is that I want to be able to take my shirt off in public. And I should really be able to say, fuck everybody, I look like a guy, and it doesn't matter if I have tits, right? Because some guys have tits. But I can't say that I wholly stand behind that statement. I wish I did. But I still perceive male bodies as ones that don't have breasts. And I know I should work on that, but that's one of my reasons to get top surgery. I want to look like a cis guy. Kill me. Or a trans guy, but I just don't want to have tits. Because it's kind of hard to look like a dude when you have